Good morning. Today I am going to demonstrate how to examine cranial nerves. Um, First, I will demonstrate how to examine individual cranial nerves. Then I will show how to demonstrate all cranial nerves in timely manner. So there are 12 cranial nerves. First cranial nerve is olfactory nerve. Usually you just need to ask whether patient has problem with sense of the smell. Alright, so I'm going to ask this dear. First, I will get the permission from her to do the examination. Good morning, Miss dear.
Good morning.
I'm going to examine the nerve function of your brain. It's okay for you?
Yes.
Alright. So, do you have any problem with sense of the smell?
No, I don't.
Okay. Usually that is enough. And if you want to go detail, you can use some objects which have aesthetic smell, such as vinegar, sweets, or coffee, whatever available. Then I'm going to examine the second cranial nerve, the optic nerve. There are 5 components in the optic nerve examination: visual field, visual acuity, and field of vision, then direct vision, and fundoscopy. The first 3 usually test one eye after another. So I will going to demonstrate that first. Alright, Miss dear, can you cover your left eye, please? Do not get too much pressure. Alright. Now I am going to test the visual acuity first. Can you see this letter? 638. Okay. Alright. Then now I am going to test color vision. What color is it?
Blue.
What color?
Green.
Alright. Then I am going to test the field of vision. Make sure you are testing the field of vision by comparison method. So you compare your field of vision with her field of vision. So when you see the image, assuming you have normal field of vision, you must stop immediately. Pitfall is the examiner go too fast and miss the peripheral field of vision defect. So key is to stop when you start to see the image. Alright, this here, alright. I am covering my right eye to get a free movement of both hands. So now I am covering my right eye. So I am moving my hand. If you see my finger, say yes. Just look at my eye. Okay.
Yes. 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 Yes.
Okay. Now you can you can remove it, cover your right eye. So do the same thing again, 3 components of the optic nerve function. Can you read these numbers?
E, W, E.
Yes. Okay. What color is it?
Orange. Red.
Okay. We will do the same thing. Alright, don't remove your hand. Just look at my eye. Alright, now I'm closing my left eye. Alright, so say yes when you see.
Yes. 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 Yes.
Advantage of closing your own eyes, you will have the free movement of both hands. Alright, so now I am going to examine the right and indirect light reflexes together. The right light reflexes are the influence of the optic nerve, but indirect or consensual light reflexes under control of the third cranial nerve or pure motor. Alright, so it's okay. Remove your gloves, please. Put your hand midway. I will use a pen torch to. So first I will show the light directly to this eye, alright? And I will check the direct right light reflex on that side. At the same time, I will check the indirect light reflex on other side. Alright? Now I switch the light to the other side. checking the light reflex on this side and concentric light reflex on the other side. Okay. Usually skip the fundoscopy examination. And for the cranial nerve, usually combine with the 4th and 6th for the extraocular movement. Because extraocular muscles supplied by these 3 nerves together. Alright, I will demonstrate how to examine the extraocular eye movement. This here, just focus my finger with your eye. I am going to move it. Do not turn your head, just follow with your eyes.
Okay.
I am observing the eyeball movement on both sides. Then, now I am going to test the nystagmus. That's under control of those cranial nerves. You have to move rapidly. Then finally, I am testing for ptosis. Okay. Alright. Then another part of the oculomotor examination is to check for accommodation. Let me demonstrate it. Look at far, please. Now look at my finger. Alright. So this is a way to get the accommodation test. Corneal reflex is the part of the 5th cranial nerve examination, and I usually skip. So, afferent is controlled by 5th cranial nerve, and efferent is controlled by 7th cranial nerve. So, usually we don't do corneal reflex. So now I am going to demonstrate examination of the 5th cranial nerve, other things except corneal reflex. Alright? So, first we will test the motor function of the 5th cranial nerve. Alright? So, can you open your mouth, please? Don't let me close. Alright? So, the testing the lateral pterygoid. Alright? Can you clench your teeth? So, I'm feeling the messenger. Okay. Alright. Then I will check jaw jab reflex. Can you open your mouth slightly? So you use your tongue as a conductor, and then you will test for the jaw jab reflex. 5th cranial nerve has a sensory portion as well. It supplies the face, 6 divisions, left and right. There is temporal, maxillary, and mandibular. You need to examine all parts. But you have to go back of your patient, use a cotton wool, ask the patient to close the eye. Here, can you close your eyes? Okay. Say yes when you feel the touch. Alright? So, this is the way to test the facial sensation. Now I will demonstrate examination of 7th cranial nerve, which includes the sensory, motor, and secretory. We don't do secretory tests, which no longer do it, which called Sharma test to test the lacrimation. So we will focus on a motor, then the sensory. Sensory is a taste sensation for anterior 2/3 of the tongue. Posterior 1/3 is supplied by the 9th cranial nerve, also cranial nerve. So you can use any sweet, salt, sugar, vinegar, anything which is safe to your patient. But what we usually do is ask the patient whether they have any problem with sense of the taste. Alright, dear, do you have any problem with sense of the taste?
No.
Front part, back part, those are okay?
Yes.
Okay. Now I'm going to examine the motor function, which is very, very important because candidate must be able to pick up any features of facial nerve loss. Alright? So first I will check the function of the frontalis. Alright? So can you raise your eyebrow? Alright, you check the frontalis also on other side. Then the orbicularis, ocular. Can you close your eye tight, don't let it open. Alright, now show me your teeth. Alright, so check the facial muscle, vestibular, temporalis. Can you puff up your cheek? That is not very specific, but still considered as part of the facial examination. Finally, I will test the function of orbicular oris. Can you whistle for me? Okay. Alright. So, as I mentioned before, the corneal reflex efferent pathway is supplied by 7th cranial nerve. Alright. So now I am going to demonstrate examination of 8th cranial nerve, vestibulocochlear. We usually focus on cochlear function. That's the testing for hearing, sensory and sensory neural and conduction defect on each side of the ears. So for hearing, you can use a whispering test or you can rub your finger, whichever you like. But key is to close the other side first. Alright? So I whisper and she answers appropriately. Alright?
1, 2, 3.
Alright. So her hearing is quite okay. And now I'm going to do the Rini test and Weber test. Alright? So these two tests usually do together. You cannot separate these two tests because interpretation depends on the result of these two tests together. First, I will demonstrate how to do the Rini test. Alright? So, first, we will put the base of the tuning fork over the mustard process. Say yes if you hear ringing sound and tell me when it stops immediately. Is here. So normally air conduction is better than bone conduction, and you will see this kind of one. So do the same thing. You hear the ringing. Tell me immediately when it stops. Okay. So if air conduction giving problem, like something obstructing in the middle ear or external ear, they will not get better hearing when you move the tuning forks to the external auditory meatus. Alright. Now I am going to demonstrate Weber test. So strike and put it on center of the forehead or vertex. Which side you hear more? Same?
Yes.
Alright. Normal responses, they get equal on both sides. If one side is hearing more, that is called lateralization. Alright? It does not say whether it's a sensory neural defect or conduction defect. We need to combine with the Rinne's result to interpret appropriately. Okay? So, now I'm going to move towards the 9th and 10th cranial now. The gag reflex is usually not done on the clinical examination or well-conscious patients unless this is absolutely necessary. Alright? So I will not demonstrate gag reflex, but I will going to check the movement of uvula. Alright? So I will ask, can you open your mouth wide? Say Normally, uvula move up and it usually at the center if nerve function is okay. Alright? So, next is the 11th cranial nerve, also called accessory nerve. It's mainly motor function. It supplies the sternocleidomastoid and trapezius muscle. So, let's see how to do. Turn your face to left side. Yes. Again, my finger. Now you feel the contraction of this right side. This is examining hands. Now you turn to the right side, please, against my hand. You examine appropriately for the contraction. Or trapezius. Ask patient to shrug the shoulder. Shrug your shoulder. Don't let me press it. Okay. Now we're going to test the hypoglossal 12th cranial nerve, the last cranial nerve. Alright, open your mouth please, stick out your tongue, and you check whether it is in the center or not. It's a pushing action by both sides. If the tongue is at the center, it's no. Alright, if it deviates to the normal side, pushing to the weaker side. Alright, so do it again, open the mouth, stick out. Can you wiggle from side to side? Then you will test the power of the tongue. Can you push my finger from inside? Can you push? Okay. So that's the end of the individual cranial nerve examination. But now I am going to demonstrate how to examine these all cranial nerves in timely manner, which is important for your clinical practice, in real practice. You should not consume too much time for overall cranial nerve examination. Alright, so attention please. Now I am going to demonstrate all in cranial nerve. Alright. Good morning, dear.
Good morning.
Yeah. I am going to examine the nerve function of your brain. Is this okay for you?
Yes.
Do you have any problem with sense of the smell?
No.
Do you have any problem with sense of the taste?
No.
Front part, back part?
No.
No. Alright, now can you cover your left eye please? Alright. Can you read this for me?
638.
What color is it? Blue. What color is it?
Green.
Alright. Now look at my left eye. Don't turn your head. Say yes when you see my finger.
Yes.
Alright, it's moving or not?
Yes. Moving.
Say yes.
Yes. Yes. Yes. Yes. Yes.
Alright, now cover your right eye please. Don't give too much pressure. Can you see this number?
8. 68.
Okay. Alright. What color is it?
Orange.
What color is it? Okay. Now do the same thing, just say yes when you see my finger. Alright, I cover my left eye.
Yes. Yes. Yes.
Okay, now remove it. Can you put your hand in please? I'm going to show the light. Okay, alright. Now follow my finger with your eyes only. Don't turn your head. Right? Look at the softness. Look at my finger. Okay. Now open your mouth. Don't let me close it. Clench your teeth. Okay. Open your mouth a little. And can you shut your eye? Don't let it. Alright. Now raise your eyebrow. Show me your teeth. Can you puff up your cheek? Can you whistle for me? Alright. Open your mouth wide. Alright. Say ah, ah, ah. Alright. Okay. Can you stick out your tongue? Move it from side to side. Can you push it from inside? Okay. Can you turn your face to left side? Can you turn the face to the right side? Can you shrug your shoulder? Don't let me press it down. Alright. Close your eyes and say yes when you feel the touch. Alright?
Yes. 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 Yes.
Alright?
1, 2, 3. Things done.
Right? So, this is tuning fork. I am going to put it back of your ear and say immediately when it stops. Right? Here. Which side do you hear more?
Both sides equal.
I would like to do the corneal reflexes and gag reflexes as necessary. So this is the end of how to examine all cranial nerve in timely manner. Thank you very much.